Hello, my name is Diane, and this is The New Old Nurse. Today we're going to be discussing working the night shift. So if you've never worked night shift before and wonder what it's like and how you could ever survive it, stick around. So your first question might be, why would you ever volunteer to work the night shift? In my experience, I was working at a facility on day shift, had never worked night shift before, but they could never find anybody to work nights. They mostly had agency staff. There were some full-time night shift staff who kept telling me, you have to try it, it's so great, it's so much better than days. And I thought to myself, no way could I stay up all night. I can barely stay up past 9 p.m. How could I ever survive on night shift? But 1 month after having a particularly stressful period on day shift, I said, you know what, on next month's schedule, I'm gonna give it a shot and see how it goes. It ended up going really, really well. And actually the only reason why I stopped working night shift is because I stopped working at that facility entirely. That particular position was very close to where I live. And so I thought I could safely work night shift, meaning I could work all night, be up all night, and then drive safely home because I had a short drive. But other jobs I've had since then, they were all pretty far away from my house. And I just never was that confident about coming off night shift and having to then drive like 45 minutes or an hour to get home and wondering if I was going to get so sleepy I'd have to pull off into a gas station and take a nap. So that was my one and only experience on night shift, but I think I did it long enough to pass along some good information. So the obvious first upside of night shift is that most places are going to pay you a differential. That means that you're going to be earning more money for working at night. It sometimes can be not that much, $1 or $2. It sometimes can be like $6 or $8 more to work at night. Although that wasn't the biggest draw for me, it really was nice to work nights and see more in my paycheck because of it. It almost felt like free money in a way because I was still doing my job and just getting a higher pay for it. So if you need more money or just think you could use some extra money, night shift might be a great choice for you. The other reason why I absolutely loved night shift is because you just had more time to get your work done. Lots of day shift nurses or staff kind of were almost sarcastic about night shift, like, oh, you guys don't do anything, you just sit there and sleep all night. And I'm sure there's some people who do that, who have a job where they just pretty much put their head down and don't have any extra work or just don't do it if they're supposed to be. But for me, I never felt that way at all. I still had to do a pretty big med pass. Bedtime med pass is not necessarily as large as some of the others, but there's still a good amount of folks. Blood sugar checks are happening at bedtime. Lots of people are getting IV medications administered at bedtime if they're getting IV meds, multiple times per day. I still had all the same charting to do as the day shift, but I had different responsibilities too. For example, night shift changed all of the oxygen tubing. Night shift cleaned all of the nebulizer machines. I think at some facilities it might be CNAs who do that, but not where I worked. And for me, even if CNAs were going to be doing it, I would have helped them because why wouldn't I help my coworkers? I also did things like check to make sure things were in stock so that we could have it available the next day if I placed an order. I had to check in the huge pharmacy orders that would get delivered every night. I made sure things were straightened up and clean. If we had a new admission, I had to do things like administer their TB test. I had to, just do a lot of different responsibilities than day shift. Overall, though, I had the time to get it done. I had breathing room. That's the way that I would describe it. While on day shift, you have so much to do that you feel like it's impossible to get done. And sometimes you don't. You stay after to chart or you pass something along to night shift because you didn't get to it. The best thing about working at night was I could get to all my responsibilities. So it's not like I really had nothing to do, but 12 hours was long enough to do it in. And I really enjoyed that feeling. I enjoyed not actually sweating to get my charting done. I liked having those couple of hours kind of in between med passes and responsibilities where I could sit and do all my paperwork. I just really felt like night shift gave you the correct amount of time to get your work done, whereas day shift is overloaded. The thing that made a big difference for me with night shift, which it may not for a lot of people, Even though I still, of course, had to work holidays, I was still able to spend the time with my family on the holiday. Where I worked, if you worked the night going into a holiday, that still counted as doing your turn and working your holiday. So I can remember specifically that I worked Thanksgiving. So I worked Wednesday night into Thursday. I got home on Thursday morning. I had to make a bunch of mashed potatoes to bring to my family's house. I, of course, was not hosting after working night shift, but I still was bringing a plate. But all that I did, I came home, I cooked my mashed potatoes, I took a decent nap, and then I got up and I was able to go see my family for Thanksgiving. Did the same thing for Christmas. I came home, we were able to open presents, and then I took a nap, and then we could celebrate the rest of the holiday. So one of the real downsides to me of working in this field of healthcare, especially nursing, is that it's a 365-day job. So there are holidays and weekends that you will be working. But with night shift, it felt like I could still be around for those things. When you work a 12-hour shift during the day and you're working Thanksgiving, you're working 7 a.m. to 7 p.m., you might have a family that celebrates Thanksgiving really late, and then you can come home at 8 o'clock and shower and celebrate. My family's not like that. We always have holiday dinners around 2 or 3, and I hate missing those. And I do miss those when I work day shift, but with night shift, I didn't miss anything. I was tired. I was sleep deprived. I was yawning a lot at the table, but I still saw everybody. And that was a huge benefit to me of having that schedule. And of course, one of the best things about night shift is there's just less people around. That may sound rude, and I don't mean it that way, but it's just quieter. Most family members aren't really coming to visit at night shift. They do, but it's not as large a number as during the day. There's usually no management around. I mean, you might have a night manager, hopefully, but it's not like a dozen people, not the HR people. They're all gone. And so you just feel more like, or less stressed out. Maybe those people all being around wouldn't stress you out, and maybe you would miss having all those folks to run into and chit chat with or whatever. But for me, it felt like at night I could breathe. You had your coworkers there, you had your night manager, and then that was it. And it just felt like you had a really good energy. I don't know if it's this way everywhere, but my night crew at that facility, they were awesome. We just had the best time. We could laugh, we could help each other out. We could, McDonald's runs at 2 o'clock, coffee runs at 3 o'clock. It just felt like, well, it didn't feel like it. It's the truth. Almost everybody around you in the world or in your state or whatever, they're asleep and you guys are awake in their own little universe of night shift at work. And it just had such a good energy. I would always get to work smiling, and I wouldn't say I would leave work smiling because I'd be exhausted, but I never had the same level of anxiety going into night shift that I do for day shift. It always was like, I'm here. Hey guys, let's get this night started. We would just, get on with our work and laugh about it. Day shift, it's like sweating bullets. Oh my gosh, who's doing that? Oh my gosh, did you hear her? It just seems like a lot more hectic. It is a lot more hectic during the day. Nighttime, for the most part, quiet, chill, good energy. I loved that about night shift. Okay, so let's talk about the downsides of night shift, because of course there are some. Number one, you are awake all night. Now, if you're a night owl, that might not seem like a big deal to you, but for somebody like me who's not a night owl and who is middle-aged, that was tough. I had to really get used to it. As I knew the days were coming where I was going to start working night shift like a couple weeks before, I started to push my bedtime later and later at night. The first night I stayed up till like midnight, which I hadn't done except for like New Year's Eve. I'm not even sure the last time I stayed up till midnight. I'm just not somebody who stays up late. It felt like an impossible task. And being up all night is not what your body wants to do. It just isn't. Again, you might fall into that small percentage of people who are night owls, but most of us aren't. Even most of us on night shift aren't. And it just feels weird to be awake all night. And I can remember after doing it for a few weeks, I'd see friends or family and they'd go, gosh, you look exhausted. You look terrible. And it wasn't that I wasn't sleeping. When I would come home in the morning, I would sleep. But somehow the body is not working the way it normally does. Your I don't know, throwing off your hormones, or I don't know what it's doing, but it is a huge downside of night shift. And it's something I do think you can in general get used to, but it's also something that will always be a challenge. You know, there's studies that say people who work night shift have higher chances of developing all sorts of issues. And I believe it, because your body is programmed by the sunshine, by the light, you're not doing it. You're doing it in reverse, basically, and it's not good for you. So that is one of the biggest challenges I faced. And it would be hard for me to go back to it now, even though I did do it for a while. So, you know, that upside I said about how there's fewer people around, that also means there's no help around. You know, during the day, there might be, depending on the size of the place where you work, where I worked at that time, there was, probably about 10 nurses on the floor during the day, plus management. So there was always somebody to ask if you didn't know how to do something, if you needed assistance to do something. Like, I can remember one time during the day, we had to put a catheter in a female who was particularly difficult. People had tried multiple times. Anyway, to finally do it successfully, it took about 4 of us to maneuver this poor lady into the right position. That wouldn't be able to happen at night shift. There's not that many people around. We would have overnight, we would have a total of 2 nurses for the full overnight shift. We would have a nurse manager who was there for part of it. We would have med techs and CNAs, of course, but on staff, actually 2 nurses for those 12 hours. That's it. So if you needed help with something, you're on your own. I mean, a lot of the stuff you could put off onto day shift, and when they would come in, you'd say, I'm sorry, we couldn't get this done. And that wasn't BS. That was the truth. You could not do it without the extra help they have on day shift. But if you are a new nurse, or you're a nervous nurse, paranoid nurse, night shift may not be the best choice for you, because you don't feel like you have that support system. Luckily, the medical director where I worked was fantastic. So any calls in the middle of the night or anything he took, he never was grumpy about it. He was awesome. Our director of nursing was the same way. So I felt supported from afar by our management, who you could call or text. But having those extra hands on deck, you didn't have it on night shift. You were on your own pretty much. And to tack on to that, because a lot of times places have difficulty getting night shift nurses, there's a lot of agency staff at night. And we love our agency nurses. We couldn't run without them, but there are a lot of agency nurses who don't do their job. I hate to put it that way, but they really don't. And if it's you, a staff nurse, and then 3 or 4 agency nurses all around you, you're it. You're kind of the one responsible for the building. That's how I felt about it. And I was not comfortable with that. I also had agency nurses who I knew weren't doing the paperwork they were supposed to be doing. I knew, you know, it felt like, because I was a staff nurse, I had to hold their hand a little bit more, and they're probably getting paid way more than I was because they were agencies. So it felt like a really unfair situation. Of course, there are wonderful agency nurses too, but if you have an experience with a bad agency nurse, and it's at night, and there's less staff around you for support, that can be a bad situation. I wasn't comfortable with it. You might not be either. Are there agency staff nurses during the day? Of course. But typically, then at least management is there to help you with any questions or problems that arise. You're not the only staff person on site at that time, whereas at night you could be. One thing I really didn't like working as a night nurse was if we had a new admission, particularly a new admission that came in late in the afternoon, which that can happen a lot. A lot of times hospitals, especially like on a Friday night, like to dump their folks off, 6 or 7 o'clock at night. And we didn't have all their medications available. We would have some of them, but not all of them. And particularly pain medication. We might not even have orders yet for the right pain medication. And I can remember a couple of instances where I had these poor folks who had come in for rehab, basically, physical rehab, and were uncomfortable. I could give them Tylenol, stuff that we had on hand, but basically for overnight, it was just terrible for them, and it was difficult trying to be the best nurse I could be for them. Stuff was not going to be able to get resolved for the most part till the next day. Now, that may have been a facility issue. Maybe other facilities would have more stuff just in stock at night. And we did have some things, but not, when you're talking about like narcotic pain medication, sometimes you have like 1 or 2 pills available In the Pyxis, you don't have everything. You don't have like a full card for them of anything. And it was so stressful when we'd get a new admission. You really didn't know how it was going to go. Sometimes these folks come in and they go back out to the hospital the next day. Maybe they were discharged too quickly, or, you know, maybe just something went on after they arrived very quickly and they had to go back. And so when you're a nurse at night and you're dealing with a new person who nobody knows, we don't have everything in place for, it can be pretty stressful, and you feel a little bit like you're drowning sometimes with these folks. Some of them are wonderful, some of them are understanding and are patient, some of them are not. And, you know, I understand. They're uncomfortable, they've just been in the hospital for a while, they think that you're going to be able to have everything ready to go for them, which is, I think, a reasonable expectation, but it's not reality. During the day, if a new person comes in, a lot of times things can be handled during the day by people other than you. Or things can be, you know, the pharmacy staff are all answering the phone in the day. You can get things sent quickly at night. Not necessarily the same experience. So just think about that if you're working at night. Again, it's all down to you. This may not be the case in a hospital, but in a smaller skilled nursing rehab situation, it very well might be. Overall, would I work night shift again? Yes. I would have a couple of parameters in place though before I would accept the position. One, I would want to get paid more money, because even though that wasn't the main draw for me, it is very disruptive to work night shift. It's disruptive to your life to work night shift. So I just feel like it's worth a little bit more money to take home. I also would want to check the assignment of the facility before I agreed to it. Some of these facilities really push the ratios at night. They probably shouldn't. They definitely shouldn't. But there was one situation where I thought I was going to have about 50 people as the night nurse. And I said, no, I'm not willing to take that on. Some people have no problem with it. There's like 50 people, kind of, I'll get to it when I get to it in terms of taking care of that many folks. But having worked nights, knowing that you might be the only person who's doing all the IV meds, who's there if anybody's suddenly, you know, having chest pains, has to be sent out, and then somebody falls, then it just is not for me to take on that many people and be responsible for them. So that would be definitely something that I would ask about before I did it again. I'd also ask about how many CNAs are on staff at night. A facility I worked at used to have like 5 CNAs at night. They went down to 2. Now maybe 5 was too many. I don't think you can really ever have too many CNAs, but 2 was not enough. 2 was good enough for if everything went perfectly. And of course, a lot of these facilities are budgeting based on everything going perfectly. That's how they want their staffing. But I've had too many experiences where things do not go perfectly, and I do not only want 2 CNAs and myself handling a whole hall full of people. So be smart. Like any other nursing job, if you're going to take it on, you ask questions. You see what you'd be willing to accept. Keep in mind that if it's at night, that opens up a new set of challenges, because there's usually fewer people and fewer resources. So if you thought to yourself, well, I'd have no problem having 35 patients during the day because there's 5 other people you could call on for help, think about whether you want those 35 people if you're completely by yourself. Most of us would probably say no. But, you know, just consider that before taking on any night shift position. I think I'm going to do a separate video on what I did to survive night shift, particularly as somebody who's not a night owl, as I said, and middle-aged and needs her sleep. So if you're looking for information like that, stay tuned for a future video. If you have any questions or any comments, please leave them down below. Tell us about your night shift experiences. Tell us about the craziest things that have happened. Maybe I'll do another video about my craziest night shift stories. But until then, see you next time.